Okay, welcome everyone. My name is Warren McDougald. I'm the Communications Officer at the McEachern Institute for Public Policy and Governance at Dalhousie University. We're fortunate to have Dr. Jacqueline Gahagan, the Principal Investigator for this project, Professor of Health Promotion at Dalhousie University. And she's going to be joined by Horst Back. My name is Warren McDougald. She's going to be joined by Horst Back, co-coordinator at Living Out Visibly and Engaged Community Response Network, and Nathan Sparling, Chief Executive at HIV Scotland. So Jackie's going to present for half an hour, and then there's going to be a little bit of a discussion with Jackie, Horst, and Nathan, and then we're going to open it up to a Q&A. To ask your questions, you can email them to mipp@dal.ca, or you can post in the Facebook comment section, and we'll be sure to have your questions asked to the presenters. So without any further ado, I'm going to pass it off to Jackie, and she can begin the presentation.
Great. Thank you so much, Warren, and welcome everyone. The purpose of this webinar is essentially to provide some key findings from our Phase 1 Social Sciences and Humanities Research Council grant, which is focused on understanding the housing issues facing older, by older I mean 55 years of age and older, LGBTQ folks in Canada. And really, I want to just put a big shout out to all of the folks who supported this grant and everybody who contributed to making this grant possible. Thank you to the funders, the Social Sciences and Humanities Research Council, and thank you to all of our partners from Canada, the US, from Scotland, from Spain, and from Sweden, and others who provided feedback into the proposal. And so again, what we're going to do tonight is just talk very briefly about some of the key findings from our Phase 1 partnership grant. And just by way of introduction, what I'd like to do is provide a very brief backgrounder on LGBTQ issues in the Canadian context. The second part of this presentation will cover the purpose of our Phase 1 SSHRC study. And then the third part will talk briefly about the preliminary data from our Phase 1 SSHRC study. For some of you who are on this webinar, you may not be familiar with all of the terminology around LGBTQ issues. And so I just wanted to start here because for the purposes of this grant, we specifically use the term lesbian, gay, bisexual, and trans, so LGBT, in part recognizing the generational divide in terms of how baby boomers, so those are the folks of interest for this study, would have used the term LGBT, and less so some of the other terms that we currently see today, including the LGBTI2S. So let's have a look then at some of the issues facing LGBT older adults in terms of health and social inequalities and inequities. So we know that there's been a variety of advances in terms of LGBT human rights legislation and law. And that's an important thing for us to keep in mind in relation to issues around housing. So we know that, for example, in 1969, same-sex sexual activities between consenting adults were decriminalized as of 1969. It's also important to note that despite the fact that that legislation came into place in 1969, there were still many instances of sexual minorities and gender minorities being the source of public raids of bathhouses and other public places where LGBTQ folks would necessarily interact. And so for the baby boomer generation, which again, as I said, is the focus of this grant, the decriminalizing of same-sex acts was an important watershed moment, but I would argue not enough to address ongoing discrimination, including discrimination that we face in relation to housing. So other protections were not in place for many decades, and we know this in the context of Nova Scotia, where I'm currently housed. Same-sex marriage didn't come online until 2005. So there's lots of variability in terms of the uptake of those policy and legislative changes. And the reality is, despite those changes, we still know that there are a variety of issues around discrimination and harassment that our communities still face. So we know that existing policy knowledge and gaps have important implications for housing. And in fact, this is noted in the National Housing Strategy, whereby we have a dearth of information about the housing needs specific to our communities. On the next slide, we're looking at, this is a slide, I'll give credit to the Public Health Agency of Canada, and I used this slide in a recent talk I gave with CIHR and others who are interested in understanding the sort of context within which LGBTQ rights may have been enshrined in Government of Canada legislation, but in fact, we know that there are many instances where these have not actually manifest themselves in changes within health and housing systems, for example. So despite the fact that amendments to the criminal code to decriminalize homosexuality occurred in 1969, it wasn't until 2018 that we see the Government of Canada releasing policy directions on modernizing the government's sex and gender information practices. So we've got a ways to go, I would argue. And I think one of the areas that we see this manifests itself is in terms of key determinants of health. So on the next slide, you'll see a schematic that many of you are familiar with, which is essentially the model of determinants of health that's been in circulation since 1991. And the importance of this is really to look at the fact that individual so-called lifestyle factors, which is not a term that I generally use when I teach this content, has important implications for things such as work, education, housing, health, unemployment or underemployment. And we know those are incredibly important factors in relation to things such as housing and meeting the housing needs of more diverse and vulnerable populations. On the next slide, you'll see a couple of slides related to the structural determinants of health. So kind of moving forward from the earlier determinants of health model to actually look at how socioeconomic and political context influence health and well-being. And a big driver of that, as you can see from the schematic, is the impact on equity and health and well-being relative to the kinds of policies and health services and health systems that we have in place. And on this slide, you'll see in the bottom right-hand corner, a slide that depicts that there are 52 states in the US, and 31 of those 52 states still have no laws against housing and employment discrimination. So the purpose in showing you these slides is essentially to illustrate the fact that although we are moving ahead with a variety of legislative and legal changes in the Canadian context and in the US and elsewhere in the world, there's a lag time between how those changes in policies and legislation actually inform how we allocate resources, including social resources such as housing resources. On the next slide, you'll see a brief sort of background on the earlier research that we did on LGBT housing in the EU. And this first phase, this presentation that we're talking about tonight, the phase one grew out of our earlier work in the European Union Center of Excellence, looking at housing models for older LGBTQ folks in select EU states. And the work that I'm going to be presenting on tonight builds on the idea of housing as a portable benefit, which we can see well illustrated in select EU states. We also know that this work identifies housing as a key site for health interventions and programs. So in other words, using housing, if you will, as the opportunity to bring innovations to individuals and allow individuals to age in place. So again, not uprooting people for the sake of reaching an age threshold, but rather looking at how we can sort of integrate interventions and programs to better meet the health of LGBT adults across the life course. And so what we've seen in our earlier work in the EU is it suggests that there's a need for more innovative policies and programs to better meet the housing needs of older LGBTQ adults across the life course. which is probably not a big surprise to folks on this call. So for our phase 1 research, our research team really focused on looking at 3 data points, and the title for this project is Addressing the Knowledge Gaps in Meeting the Housing Needs of Older LGBT Canadians, from Research to Policy to Practice. And the reason why this came about is that when we look in the Canadian context, and as stated in the National Housing Strategy, we don't actually have sufficient data. In other words, data are not being captured in large scale population-based surveys and in other mechanisms to actually see how well LGBTQ populations are being served. And the problem with that data gap is that we're making decisions about policies and programs in meeting housing needs without necessarily taking into consideration the unique housing needs of LGBT Canadians. So our study then focused on 3 data points, as I mentioned, the first of which is a scoping review of existing housing policy, knowledge gaps in relation to the housing needs, specifically of the baby boomer generation, which is those who are 55 years and older, who identify as lesbian, gay, bi, or trans. The second piece was an online survey to gather data nationally from LGBT Canadians. And the third piece was a series of focus groups with LGBT Canadians on their experiences and perceptions in meeting their housing needs. Now, in the next slide, you're going to see just another kind of schematic, which talks a little bit about the scoping review, which is looking at the existing housing literature, and that looked internationally at the housing literature, specifically to the housing needs of LGBT folks. That piece is underway. It's been slightly set aside for the time being, but the second data point, which is the online survey of older LGBTQ folks, we had 982 respondents, which is fantastic. And the third data point is the focus groups that we conducted with older LGBT Canadians and housing and service providers. And those focus groups took place in Halifax, Ottawa, Winnipeg, Calgary, and Nanaimo. And thank you to all of the folks from our team who helped facilitate and bring folks together for those focus groups. We'll just talk very briefly about key findings from the scoping review, and just to give you a sense of the inclusion criteria. In order to include studies from the existing literature, it had to examine 1 or more segments of the LGBT community as part or the entire focus of a study population. It also had to examine a specific residential context broadly considered, including particular types of housing situations, so prisons, retirement homes, campus residences, live-in mental health facilities, etc., and communities, so gay neighborhoods, local, rural, and lack of residents, so folks who might identify as LGBT who are homeless. And the last criteria was that it had to examine issues around accessing a residence or amenities related to quality of life in a residence. And here in the next slide, you'll see just basically kind of high-level key findings. You can see the breakdown by the numbers of studies that met the inclusion criteria, which is a total of 176. And you can see that the vast majority of them are sort of clustered around the area of homelessness and housing precarity, which, as you know, is one of the key foci for the National Housing Strategy. The second, which I think is really important, is looking at perspectives on aging and care for LGBTQ folks. And then the third sort of large cohort that we heard or read about in the literature was related to student population studies. On the next slide, you'll see just kind of key findings from our scoping review. And again, this is a piece of work that's ongoing, so we don't have final data on the scoping review. But most of the studies that we looked at were descriptive in nature. Very few of them actually focused on housing intervention. So in other words, what did you do to resolve this issue? Many of them were describing the problem, but not necessarily looking at system level solutions. So basically the takeaway from the scoping review key findings is there are long-standing tensions between the realities of lesbian, gay, bi, and trans populations in housing and in the inflexibility of existing policies, programs, and funding models unlike what we saw in our earlier work in the EU, where there's an issue of portability. We also found the need to focus more on policy and system level drivers and to figure out how to address those. And we also heard about the need for better administrative data. So as we also heard in the National Housing Strategy, and it's declared a knowledge gap, and that we don't have great data on the housing needs of LGBT populations in Canada, and this is also reflected in our scoping review findings. On the next slide, you'll just see a very brief overview of the online survey findings. Again, as I stated earlier, we had a total of 982 completed or partially completed surveys. The vast majority of participants who completed the survey were from Ontario. The next largest cohort of folks to participate and complete the survey were from Nova Scotia, and 20% were from British Columbia, and the remainder were from other regions. And again, I think this is in part a reflection of the work that was done by our team members in making sure that the link to the online survey was sent out more widely. Excuse me, the average age was 55. The majority of folks self-identified as white, 6% as Indigenous, and the remainder as other. And just over 53%, just over half, or 53%, self-identified as gay, 30% as queer, 27% as lesbian. 35% of our respondents self-identified as having a disability, and 80% of those who self-identified as having a disability refer to their disability as invisible, and 11% reported having a visible disability. The average income reported was between $20,000 and $49,000 Canadian. And the main source of income was from employment, or and less so from, excuse me, from public pension. When we asked the question, what's the type of housing you're currently in, 39% said they are renting an apartment, 30% said they rent a house, 13% own a house, 13% rent a house, 10% own a condo, 2% are in co-ops, 2% in mobile homes, and 1% in public housing, and 8% in other. Excuse me, when we asked people what were the key housing challenges they faced, 38% reported rising rent as a key housing challenge, 20% spoke to the need to move due to unaffordability of their current home, 6% reported being evicted, 5% reported being homeless, 1% reported foreclosure, and 31% reported a variety of other reasons for being in a housing challenge situation. We asked people about negative housing related experiences in the last 5 years, and in fact 36% of our respondents said yes, they had been in a negative housing related situation. When asked why, 15% reported being uncomfortable discussing their sexual orientation with their landlord, 10% were uncomfortable discussing their gender identity or expression with their landlord, 9% do express discomfort due to heteronormative intake forms, 9% talked about not an inclusive space, 7% reported their identity was not reflected in their surroundings, such as posters and signs. We also asked people about positive housing related experiences in the last 5 years, and 50% said yes, they had had a positive housing related experience. And when we asked why that was the case, 19% reported an inclusive environment, 19% felt comfortable discussing their sexual orientation with other residents, and 17% reported that staff and the landlord were LGBTQ friendly. Switching gears a little bit, we're going to look now at the key findings that emerged from the focus groups. The focus groups took place in November 2019 in Halifax, Ottawa, Calgary, Winnipeg, and Nanaimo, with older LGBT adults who are 55 and older, regarding their social and or housing situations, and that could include providers. So we did have, in fact, some providers who work with this particular demographic, and they came together to talk about their perceptions and experiences with housing and issues related to housing, such as affordability and safety. The key issues that were raised included a lack of LGBT-focused options, the need to hide one's sexual orientation and or gender identity from other residents and or housing providers, so hiding their identity from staff or landlords, facing harassment and or violence from residents and or community, being afraid of being too visible, being ostracized by non-affirming staff, a lack of lesbian, gay, bi, and trans homelessness supports, and overall loneliness and isolation. And some quotes to offer with respect to this issue from the focus groups. A respondent from Calgary said, "There's no respect given in the shelters for people who are queer or who have different gender identity." Another participant from the Winnipeg focus group stated, "There's a lot of fear about housing, whether it's a non-accepting neighbor or there are protection policies that are not being enforced." And then we heard also from a Nanaimo focus group participant, especially in care homes, I've heard very bad stories about people in those places being treated badly. So what can we do about these findings? A couple of suggestions is to think about how we can collectively advocate for a national program of housing research focused on the needs of both older and younger LGBTQ Canadians, taking an intergenerational justice perspective. We could seek additional sources of funding to move this work forward. So again, if people on this call have suggestions about that, please feel free to share. And we need to continue to mobilize our findings within the housing sector. So through co-ops, assisted living, long-term care, including builders, planners, architects, as well as with government and community members. And I would argue we need to develop an LGBT specific housing business plan to seek funding from Canadian Mortgage and Housing Corporation. And so we're really interested in your thoughts and ideas on how to meet our respective housing needs, and what are your thoughts and ideas about related projects and interventions and how we can mobilize the key findings. And we're looking for additional input from LGBT Canadians. So just by way of wrap up, I wanted to thank our team, particularly our international team, which is made up of over 40 partners from 5 countries from across academic, community, research, and government sectors. It's a multidisciplinary group of folks representing sociology, anthropology, planning, occupational therapy, law, social work, public health, etc. And it focuses on the lived experiences of lesbian, gay, bi, trans, and queer Canadians. And I'd like to thank the McKechnie Institute for Public Policy and Governance for their support of this work and this webinar. And I'd also like to thank the Healthy Populations Institute for their support for this work. If people have other questions or comments beyond this webinar, they're welcome to email me or Warren. You can see our contact details on the final slide of this webinar, but I will stop there and open it up for questions. And I believe we've got Nathan and Horst here to help facilitate that process.
Hello.
Hello.
One of the things that struck me in your presentation earlier was the level of invisibility of a number of things. I think the idea that there are a large number of people who have low incomes who are seniors is surprising, I think. I'm not quite sure how LGBT populations compare to others, but whether the people who did the survey are similar to other seniors. The other thing that struck me is the level of invisible disability as well that you identified. And then again, from a policy perspective, I think a lot of times LGBT folks are left out of consideration because of systemic kind of ignoring our population. So we don't really have information collected on a regular basis about our populations. Mm-hmm. And also, I think probably a lot of concerns about openness for the individuals themselves. Mm-hmm. Do you have any ideas or thoughts about any of those things?
Yeah, thank you, Horst. Those are really great observations. And for sure, the issue of systemic invisibility really is something that we're hearing. And I think it's important to loop that back to policy decision makers, because there are reasons why when holding policy discussions about housing, you know, the government of Canada, for example, is not seeing a whole lot of LGBTQ seniors coming forward because they fear those or distrust those systems that have been in place that really historically have not been very mindful of their unique needs. So there's a bit of a tension, I would argue, between you know, issues of low income, vulnerable LGBTQ populations who really don't want to buck the system because of the fear of what the consequences might be. And we did hear that quite loud and clear in the focus group data, for sure.
I think, you know, my interest in this area, Jackie, is around that intersectional stigma, and I know that came up quite a lot in the focus groups and from the survey, was almost people experiencing stigma in very different ways, and everyone experiences it either as in yourself, so that's self-stigma, or the interpersonal or community level stigma, or the structural, or, you know, the laws and rules around different things. And I think that's what's really interesting, is that people generally only look at one level of stigma when they experience it, but actually the way that we can eradicate that stigma for LGBTQ people, or, you know, my interest is specifically in Scotland among people living with HIV, but it does transcend all of these things. If you have the right structure for dismantling that stigma, it has to happen at every single level. And I think that's what's really interesting with seeing the results from the survey and the focus groups, is people seem to only experience stigma, perhaps, or they only talk about stigma that they've experienced in one specific way. So it's maybe the bit of stigma that's affected them the most. But in reality, these people will have experienced stigma in all of the socio-economic levels. That's why we just putting up posters in a housing estate isn't going to change the laws of the land, or isn't going to change the opinions of people. And that's why we have to look at across that more broad range at every level.
Mm-hmm. Yeah, no, Nathan, that's a really important observation. And I think one of the reasons why we use the social ecological model for the study is exactly to what you're describing, is there are multiple overlapping levels of influence that can create the sort of perfect storm, if you will, around stigma. So at the individual level versus I'm an individual who may not experience stigma in my immediate community, but where that becomes problematic is I go to interact with a housing provider, or in some instances, a social housing provider that might work for government. And the expectation is they have the ability to understand the unique housing needs and issues facing LGBTQ folks, and that's not necessarily true. So kind of weaving that sort of, I think you called it, that intersectional stigma into concrete solutions is a really important observation, Nathan. And I think that was the intent, was to take the phase 1 research, which is using that social ecological model to understand the various levels and drivers of housing precarity for LGBTQ folks, and then move that forward into you know, further work that can actually take that evidence, bring it to policy decision makers and say, right, the issue of stigma is not just legislated away. It can be stigma that happens within a housing facility, and we did hear this quite clearly from participants, that they may live in a so-called affirming housing space, but if they're an HIV positive older gay man, it's a kind of a triple whammy. Not only do they not necessarily want somebody to know their sexual orientation or their HIV status, it's the fact that you've got different levels of decision making, the residents being a voice, but the housing providers being another voice, and that sometimes that what we heard was that enforcement fails to protect particular populations that have those intersectional housing issues that lead to multiple forms of stigma and discrimination. And I think that is something that's unique to our older LGBTQ populations, and something that I think really warrants further work. Thank you for that, Nathan.
There's a question from Stephanie. Have you connected with the Senior Pride Network in Toronto for your research?
Thanks, Stephanie, for that question. We have connected with the 5 sites that were part of our 1-year grant. So it was the Senior Pride Network in Ottawa. So that's our dear friend and colleague, George Hartsgrove. And so we have in each of the 5 sites our community organizations that serve older LGBT seniors, and those are the folks for this particular short duration 1-year grant that we worked with. The intent was to then scale up in the next phase of this work to other partners who provide services to LGBT seniors outside of those 5 sites. So the 5 sites that we're focusing on for this 1-year phase 1 grant were, as I mentioned, Halifax, Ottawa, Calgary, Winnipeg, and Nanaimo. And the hope was to sort of branch out from there and look for other senior serving organizations that have a focus on the needs of LGBTQ folks. So no, we haven't gone beyond that, Stephanie, but we'd be happy to connect with you by email if you're interested in providing additional suggestions and ideas for moving this work forward. So thank you for that question.
Jackie, I'm wondering if you could just reflect a bit on the challenge of poverty in the populations in sexual and gender minority populations.
Yeah,
and its
that's
effect on housing.
For sure. Thank you, Horst. That's a really important question. So as you saw from the data that I just presented, the average income being between, say, $20,000 and $50,000, depending on where you live, but keeping in mind that this was a national survey. So it was not just for the 5 sites that we collected focus group data. So it's national in that sense. That's a very low level of income. And the important observation, I think, is not only is the level of income quite low, the level of income for the majority of people, that's coming from full-time employment. So what we did here in having an earlier conversation about this issue is for folks who are trans or gender non-conforming, there are significant issues about underemployment, and for LGB folks, there is as well, having higher levels of completed education, but lower levels of income. And that would speak to, again, as Nathan Sparling has suggested, sort of intersectional forms of stigma and discrimination, which I think the end result being, and I know you know this, Horst, the end result being that you have less disposable income to put into housing, you have less disposable income to put into savings, and things that people who are of the baby boomer generation might actually need later in life. So what the effect of that essentially is, as we know, is that you have fewer choices. So if you've worked underemployed or unemployed because of your sexual orientation or gender identity, as you get older, you have fewer financial resources such as pensions or other things to draw on, which may mean, sadly, you end up in a government subsidized or government funded housing facility, which we know in many instances are not addressing the unique needs of LGBT Canadians. And that becomes kind of this full circle of a lifetime of systemic intersectional discrimination ending up at people's older years in reducing their likelihood of finding a safe, affirming, affordable place to live. So it's kind of a full circle. And I think the reason why we focused on baby boomers is that is a generation that came out, that fought for our collective human rights and recognition. And they're the same generation that sadly, towards the end of their life, may find themselves living in poverty. And as a result of living in poverty, have less ability to find safe, affordable, and affirming housing that works for them. And that, to me, is really quite a tragic story.
When I looked at the findings of your of the survey, 38% of finding a challenge with rising rent. That's 2 out of 5 people. That's a lot, and a quarter. 1 out of 5 had to move because it was unaffordable. That's amazing.
Well, Horst, what's also amazing about that is what we read in the survey. There were 69 closed-ended questions, but there are also the ability for people to provide open-ended contextual data. And in some instances, people said, my building is being gentrified, which is code for getting rid of the gays. So in some instances where landlords have the ability to say, we're increasing the rent to make it market rent because we're doing all of this gentrification in the building. So you have the choice of paying double rent or moving out. And so we've heard that, and it was actually documented in the open-ended component of the survey. And it is also something that came up in the focus groups, that if a landlord doesn't really like the balance of people in their buildings, in some instances, there are situations where the landlord can use their ownership privileges to get people out of those situations by increasing the rent and making it unaffordable. So that's part of I think the connection to that level of lifelong discrimination by being in situations where the rent goes up and you're not sure whether it's because you're gay or trans or because the landlord actually can do that. And in some instances where people have said, they have actually been told they can't get into an affordable building because the landlord or the person who owns the building doesn't really want trans people in their building because they could be disruptive. So people have actually had those experiences, and here we are in 2020. So despite all of these legislative and legal protections, we're still seeing instances where older LGBTQ folks are still having to fight for safe, affordable, and affirming housing.
Also, looking at the 5% homeless figure that you provided, do you have any idea of what that who was in that 5%, or was that currently homeless or previously homeless or a history of homelessness?
Yeah, so it's a history of homelessness, and so we don't have a whole lot of data that kind of correlates what was the issue that created homelessness for those individuals, and so we can look a little bit further in the open-ended responses to those questions, but in the final report that Marco and I put together, there wasn't enough specificity to give us a sense of, was it a homelessness issue related to affordability? Was it related to some other situation? We don't have that level of specificity. And I thank you, Horst, for asking that question, because one of the reasons why we're doing this research is in response to the National Housing Strategy basically saying, we don't have enough specificity in the data that we're collecting. We have limited data about LGBTQ Canadians and their housing issues. So I think the issue of homelessness, particularly for older LGBTQ folks, is something that really warrants further investigation. Absolutely.
Just a reminder to folks that they can, if they have questions, they can leave them in the comments on the Facebook Live, or they can email them to mipp@dal.ca.
Great, thank you.
I'm wondering if you could also maybe briefly talk about the fear about hiding sexual orientation or gender identity. That came through in the focus groups. Certainly, that appears to have come through there as well. Yes.
Mm-hmm. Yeah, I mean, interesting question, Horst, because I would have to say one of the big pickup pieces for the media nationally was this notion of LGBT seniors having to go into hiding when they seek out assisted living or long-term care facilities. And, you know, it's maybe the nature of news media looking for a hot topic, but that notion, I think the caption was the final closet. And I had more email and phone calls as a result of that piece about hiding your identity being picked up by media nationally than any other part of the study. So again, it's kind of a byproduct, I think, of, you know, media wanting a hot topic or a hot story, but really the situation for hiding one's reality, so their sexual orientation or gender identity, is a really significant concern. And so again, what we heard in our focus group data is people not wanting to risk being out in a situation where they don't feel safe and they worry about the kind of treatment they might receive and or the possibility of being evicted from their building. And one of the, you know, really, there are many very telling and very troubling stories, but one I recall, because I was there when we were doing that focus group, was a person saying, I don't want people to know who I am. Like, I don't want people to know my personal story because I risk people finding things out about my personal story, about my sexual orientation, that may mean that I am the subject of violence or stigma or harassment in my building. And so this person said, I basically come into my apartment, I go to my unit, I lock my door, and when I hear something happening outside of my apartment door, I don't go and look and see what's happening. I live in fear of the possibility of, I open the door and the people who are out in the hall making a fuss are doing it to bait me, to get me to go out in the hall so that they can confront me and accuse me of whatever, something to do with their sexual orientation. And this is a man in his 70s who has been out and gay his whole life and lives this very choreographed existence to ensure that he is not the subject of violence, harassment, or other forms of stigma that may mean that he is asked to leave the building. So he's very, very, very careful, goes out, does his groceries, does whatever he needs to do, comes home, locks the door. And if there's something going on in the building, he doesn't participate in it. He doesn't open his door to find out what it is. And to me, that's really heartbreaking. And it also is another piece that we heard in the focus group data, which is there are laws and regulations in place, but they're not being enforced. So in other words, if you live in a building that is meant to be a safe, affirming building, and the people who run the building don't want to get in the mix of tenants arguing about who said what, that there is no safeguard for an LGBTQ person necessarily to come forward and say, you're not actually fulfilling your obligation to enforce the rules that are around anti-stigma, anti-discrimination, or whatever it is. So there's a bit of a push-pull between the fear of being out and the need to hide, recognizing that those safeguards may in fact not help you out, and they may in fact lead to you being asked to leave a building. And that's, you know, we heard that in the focus group data loud and clear.
Possibly even just the fear of being ostracized, social outcast, being a social outcast.
Mm-hmm. Definitely.
Yeah.
Some of the work, Jackie, that you and your team did early on was that comparison with other countries and looking at what was already there and recognizing that a solution for housing for LGBT older people might not necessarily come in the form of bricks and mortar. And I wonder if it might be quite nice to talk about what some of those existing services and premises are, and what potentially a solution might look like for LGBT Canadians.
Yeah, no, that's a great question, Nathan. Thank you for that. We definitely heard very strongly in the work we did in the European Union was portability of benefits. So in other words, if you're an out gay man living in London, England, and you want to go to Spain, there's portability. So your social benefits, if you will, are portable. You can go live in a gay affirming, presumably more affordable place in Spain and have the same kind of reciprocal between Spain and the UK portability of benefits so that you can go there and have your health care and have a certain quality of life or standard of living, and go find a place that might be more affirming. So one of the examples we heard was a housing facility, and I wish that Liesl was on this call because Liesl did the in-depth interviews, but there was a housing facility in Berlin where it was kind of a one-stop fits all. So there's a more intensive a kind of facility on the main floor whereby people who have come out of hospital and have had a hip replacement surgery, their apartment upstairs is being cared for while they're recovering. And when they're well enough to go back up to their apartment, that apartment is being saved for them. And so I think there's something very, I think, important about the portability issue, the training of staff and the enforcement, and the fact that in those facilities, excuse me, in those facilities, there are lots of LGBT folks working in those facilities, and they embrace the fact that they are working with this generation of LGBTQ folks who were served as the early adopters and the advocates and the fighters to actually change the way government understands the importance of housing needs and social needs and healthcare needs of LGBTQ folks. So it feels like, and I mean this with all due respect because there's lots of great work that's happening in Canada, but it does feel a little bit like we are behind where several EU states are in terms of ensuring that those solutions are respectful and inclusive of LGBTQ folks as they age. They have been contributing in the workplace, they have been paying taxes, they've been doing everything like everybody else. And at the end of their lives to say, we don't want you here is not appropriate. So training of staff and ensuring that staff that come into those facilities in the examples that we looked at in the EU, people want to work there. There's a younger generation of people that actually want to work in a facility that is specifically set up for LGBTQ folks. So I think training, portability, and ensuring that there's enforcement about legislative norms, policies, expectations about the fact that LGBTQ folks should not be in fear of their end of life, whatever that might look like in a retirement community or in a independent living situation. That should not be the predominant fear, and yet we're hearing that in the Canadian context, that people are afraid. So I think in terms of solutions, I think the Canadian government needs to do more about a targeted program of research and targeted program of housing specifically for LGBTQ folks. And not unlike the other research I do around LGBTQ health, I get asked this question: what is the denominator? And if we can't sort of quantify how big the problem is with a denominator, then people tend to be less focused on this. And I think we need to move away from that. So if there's one LGBTQ senior who's living in a building that they feel afraid for their well-being or their lives or whatever it is, that's one too many. And we actually need to bring the conversation about solutions for housing out of the closet, so to speak, and into the imagination of policy decision makers and funders. And I really feel that the work that you and Horst and others have been involved in advocating for this needs to be amplified nationally, so that we don't have to say we're like the EU. There are lots of lovely, really great, compelling examples from the EU, but we actually need to do better in Canada to meet the fundamental housing needs of our LGBTQ seniors. It's not okay for any LGBTQ senior to be living in fear. And I'm not suggesting that all of the EU examples we looked at were perfect, but they certainly did give us some innovative places to start this conversation in Canada.
One of the outcomes of poor housing or lack of community or that stigma can often result in social isolation. And I think now more than ever, we're looking at ways to tackle social isolation amongst the communities that we work with, whether that be LGBTQ folks or people living with HIV. And I just wonder, is there anything that's happening now that is being rapidly scaled up because of the circumstances that we're living in that could benefit us in the long term from actually coming up with some innovative solutions that we would never have thought of before, or they would have been put on the too difficult pile? But because we have no other option right now, we're being forced to think about ways to challenge that social isolation. And I wonder if there is any, diamonds in the rough that we could be looking at to make sure that LGBT older people are supported during this time. And I think one of those things also has to be around digital exclusion and that digital divide, because in Scotland, 800,000 people don't have access to a laptop, a phone, or data. So that's 800,000 people that can't sit on Netflix at home just now when we've nowhere else to go. That sounds pretty bleak to me, and will be the cause of much social isolation. And I think whilst we're living in a time that is completely unprecedented, there could be the opportunity to take some of these innovations forward. That doesn't necessarily mean we have to build a new building for LGBT people, but actually we've improved that social cohesion and that sense of community because we've been forced to do that.
Mm-hmm. Yeah, no, that's a fantastic question. In the time of COVID-19, the issue of social isolation is, I think, on everybody's mind. I don't have a rapid scale up idea emerging from the data, but the digital divide is a huge issue. And just to give you an example, in Nova Scotia, suddenly there's been this, let's hurry up and get high-speed internet to rural Nova Scotia. And, I always ask the question, why wasn't anybody paying attention to that file in the first place? Why did we have to wait until there's a pandemic before we actually say, the digital divide means people who can't actually physically have individuals in their home have virtually no way of or limited ways of communicating with family outside of that. So imagine in instances where LGBTQ folks are disenfranchised from their families of origin. Like I'm reaching out to my sisters, right? So I mean, so that's kind of a natural reaction to this pandemic. But for folks who are living in the closet and folks who are disenfranchised from their families of origin, what are they doing? So I do think that the social isolation piece is a big piece. And in fact, in our next iteration of this work, we were actually one of the key foci of that research was on the issue of social isolation and how to reduce social isolation. So we'll see. But I wonder, Horst, if you have any suggestions on that, because I think it's a coast to coast kind of issue about social isolation. I wonder if you have any thoughts on that.
I think it becomes more of an issue when people are in rural areas, even more so, and where internet may be spotty than in some of the urban areas for sure. And also the number of peers diminishes anyway as you grow older. I don't know that I have any possible solutions that come to mind. I just see the issues and the problems that become more magnified in rural areas, non-urban areas. And there are a lot of LGBTQ folks out in those areas, lots.
Yeah, absolutely. Yeah, so that issue of social isolation is a really, I think, something for us to be very mindful of moving forward with this type of work, because it's not enough just to give people a place to live. And as I described in the earlier example, for a gay guy in his 70s to come home to his apartment and close his door and not interact with anybody because of fear of the unknown, that level of social isolation is compounded by social distancing and other issues that are happening as a result of the pandemic. So I can imagine for people's physical and mental well-being, that's not a great place to be. So and then you're thinking, well, you could go online and find all kinds of sort of mental health directions and whatnot, but you can't if you're living in rural Nova Scotia where there is no high-speed internet. And to Horst's point, that people who live in more rural areas of British Columbia, it's the same thing there. So I think this is a really important issue, Nathan, and thank you for raising that. It was not the focus of this current study, but it certainly was part of what we wrote into the next phase of this work, which is to look at how we can creatively reduce social isolation. And so one of our partners is in Northern Ontario, and the notion of social isolation is quite profound. And the idea is to look at, creative ways to address social isolation. It's unfortunate that we're in the situation that we are in. That's I think the good and the bad of it is it's providing an opportunity for us to sort of think about creative solutions to this notion of social isolation. So it's an excellent question. I realize we're just about out of time, Warren.
Yeah, I was just going to note we're just about out of time, but there is another question from Facebook. John asks, maybe this will be our final question, but did you note the differences across Canada in your research on who the different levels of government directly responsible for housing were, and the impact it may have on the responding to the housing needs of LGBT Canadians, and also how the Canadian housing strategy fits in and addresses this?
Thanks, John, for that question. So we did ask people a little bit about, who are the Canadian government responsibility hubs, and as we know, they're sort of municipal, provincial, and then federal. So we didn't specifically ask people to talk about the different levels of government in our study. But in terms of how the national housing strategy can contribute to this, thanks, John, for asking that question, because I'm a little bit crabby about the lack of okay, I'm a lot crabby there, I've just called it. I'm very crabby about the fact that the National Housing Strategy acknowledges that there is a dearth of data and information about the housing needs of LGBTQ folks, but there is no identified point person or part of government that is responsible for ensuring that those gaps are addressed. So I think that's that was meant to be the next piece of work that this team looks at, how the government responsibility hubs at each level of government should be working on this file more actively. And I would also say I'm quite cross that the National Housing Strategy, which is the federal strategy, is not really focusing on the housing needs of LGBTQ Canadians, sadly. So thank you for that question.
Okay, I think we're reaching the end of the hour here, but I want to thank everyone for watching, and Horst, Nathan, and Jackie for participating in this panel discussion. It was very informative, and I think we all appreciate your time and your insights on the topic.
Thank you very much to Warren and to the folks who are hosting this, which is the McEachin Institute, and I imagine this link will be on the McEachin Institute website for people to look at their leisure. But certainly if people have other questions, on my final slide, you can find my email address and Warren's email address. So if you have other questions or comments about how we can ensure the housing needs of our LGBTQ seniors in Canada are actually being met through the National Housing Strategy, now is absolutely the time to do it. We've got a 10-year window, less than 10 years now, to actually make sure that we're on the radar of all levels of government to improve our housing situation. So please do feel free to weigh in on that. We'd be very happy to hear from you. And thank you to Nathan, and it's well past Nathan's bedtime. And thank you to Horst as well for being discussants on this webinar. It's lovely to see you. And again, thank you so much for your ongoing support for this work.